The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
And I certainly feel for parents of children who have a diagnosis of autism, including some of the parents that I help care for their children for. And I don't fault them at all for trying to look for reasons. But sometimes it becomes counterproductive. And we really should focus on the things we know help children with autism. And maybe we've spent enough time kind of trying to go down the road of, do vaccines cause this? I really think that the jury has weighed in on that. Not guilty.
And while we're on the subject of autism, you guys touched earlier on the fact that there's an autism screening process that's being used now. Is that correct?
And that we're looking at trying to catch these children younger and give them some benefits. The younger that we can diagnose autism and autism spectrum disorders, the sooner we can get assistance and get it recognized and
find resources.
Find resources, absolutely.
And at its base, autism is a communication disorder. There's problems about the way children interact with their environment, but it can be a challenge to diagnose before children were very verbal. And so looking for early signs like good eye contact with a parent or caregiver, sort of reciprocal interactions, I need, I do, you reciprocate back. Some of the early signs, but being at any well-child visit, we do some developmental screening by asking certain questions or using sort of check sheets. But we're trying to be even more systematic about it now. And in our practice, we're setting up where at 18 months, when we wouldn't otherwise be seeing patients, we're sending out questionnaires that are much more detailed, much more sensitive and specific, and help us get to the right diagnosis, whatever they may be, whether it's a normally developing child or a child who has an issue that needs some further investigation.
So you're essentially screening for behaviors that might be indicative of an autism spectrum disorder, but not necessarily trying to pinpoint it, just trying to figure out whether or not a child might fall into that.
Right.
Or do we need to do more screening? Is this a child that we need to watch a little closer, and we need to maybe look a little closer into this? And I think the whole issue with the immunizations and autism, I think we're picking it up before, and we're learning more than what we have in the past. And I think that's why we're maybe seeing it more.
And that's another success, isn't it?
I agree,
Yeah, absolutely.
And what if for those who choose not to have their children immunized, what stumbling blocks might they run into later in life, in the child's life?
Well, I think the most important ones would be that the reason we immunize against these illnesses is because they're serious. I can't think of a single thing we immunize against that's trivial. We'll use chicken pox, for example. A lot of people say, well, I had chicken pox, it was no big deal. But unfortunately, there's still children that die every year in the United States from chicken pox. And the older you are when you get chicken pox, the more likely you're going to have a severe case. And so that idea of, well, we'll just get exposed and it'll be no big deal, that's kind of going away. And so I think any of these illnesses are starting to show up in pockets around the country where vaccine rates are dropping, and it just reinforces the successfulness of vaccine programs. Where there's high vaccine rates, there's low prevalence of the disease. When we see those drop, we start to see them come back again. So we can't really let up on this.
Yeah, and with the chickenpox issue too, now that we have the vaccine, fewer children are being exposed to it. If they don't get vaccinated, when do they get it? Are they exposed when they're 20? and it's more serious when they're going through a pregnancy. So by getting them immunized now will hopefully prevent problems if they do get the disease later in life.
And we've heard the theory that expose them young, expose them to everyone possible, build those antibodies, and that theory is not necessarily what would
I would say, you know, if you want to do that, get a dog and let them play in the dirt. Let's not take chances with serious things like measles, with bad cases of influenza. You know, cough and colds are fine, but some of these things are very serious illnesses, and we don't want to see them again.
Right.
No chicken pox parties, right?
Yeah, and influenza can kill. You know, we know the flu shot, how valuable that flu shot is. And the recommendations have just recently changed now for children. It used to be children, you know, young children and children with some chronic health issues such as diabetes, asthma, things like that we'd recommend. The recommendations now are all children should be immunized and their care providers, moms, dads, but all children we want immunized with the influenza vaccine. And if you haven't had it, 2 influenza immunizations the first year, and then after that it's 1 influenza immunization a year following
Even
that.
if you're not a child?
If you're under, no, if you're
Even
under...
if you started.
Right, yeah.
I really think this is a community effort. I mean, individual families make decisions for themselves and for their children. But really, for vaccine programs to be successful, communities need to agree that we're going to do this for each other. Mm-hmm. If enough families say, well, all the other kids are getting vaccinated and my kid doesn't need to because they're not, if enough of that happens, then we start to see reemergence. So just like if your child has a bad cough and fever, they might stay home from school or daycare not to expose someone else. We do those things for each other, and I think vaccines are no different.
Absolutely. And the new HPV vaccine is now being administered. Do you recommend it in your practices?
I do. The HPV vaccine is a fairly new vaccine. It's been out for a couple years. HPV stands for human papillomavirus vaccine. Human papillomavirus, there's over 100 different strains. Most of them are benign. There's a handful that can cause cancer. They have them all numbered. Numbers 16 and 18 are the big hitters. Those 2 cause over 70% of cervical cancers. Mm-hmm. Those 2 strains are in the vaccine. And the vaccine is recommended for girls right now, at this point, ages 9 through 26. So we at Mayo are giving it as young as 9 or at the 11 or 12-year-old visit whenever they can come in for their sports exam, well-child checkup. And the biggest side effect is a sore arm. But we do see some fainting with it, but it's small. And typically it happens right after the vaccine.
Sure.
But
it might just be fear of the shot.
Look at the age group you're vaccinating. You're vaccinating adolescent girls.
Yes.
Yeah. So, but no, very good vaccine. Highly recommended. It's a series of 3 shots. You get one, then 2 months later you get the second one, and 6 months after the original you get the last.
Okay.
So highly recommended.
One of the nice sort of convenient things about this vaccine and starting young is that while you can get it as soon as 2 months later, it doesn't have to be then. And sometimes we started early in our practice because if nothing else, when they come in once a year for flu vaccines and they get their HPV vaccine, we'll get it done in 3 years instead of 9 months or so. And it doesn't decrease effectiveness there.
And studies have shown with that vaccine, too, that the younger we give the vaccine, the better the immunity we have. And that's where I've had the discussion with some parents, too. Well, I'll wait till, Sally is a little bit older to get it. But the studies have shown that the younger we give that vaccine, the better immunization, the better the antibodies, and the more protection we get. So if we can get that vaccine in at the adolescent years, certainly before sexual activity. Even if that's not going to happen till they're in their 20s or till they're married, we still want to get that vaccine in when they're young.
And is it known to be a sexually transmitted virus, or is it just believed to be? Is it proven?
HPV?
Yes.
HPV is sexually transmitted. Okay. Like I said, there's over 100 different strains. Most of them are benign, but there are a handful that can cause cancer. HPV can also cause warts. And the vaccine has two of them, number 6 and number 11, that cause over 90% of the genital warts.
So it should be good for males as well?
Absolutely.
Okay.
It should be. Hopefully, eventually, we'll be able to give it to males as well. And I think I want to be clear about what the HPV vaccine is not. It's not licensed to do whatever you want with whomever you want. And I think it's a good opportunity for families to have these discussions at a young
Absolutely.
age. Unfortunately, I think families often wait far too long to start talking about some of these issues with their children. And this vaccine is an opportunity to discuss, not only with your daughters, but with your sons as well, about how to be responsible and what good choices are when it comes to sexual health.
Yes.
And that doesn't mean that at 9 years old you have to have in-depth discussions. You know, we give our children shots to keep you healthy. You know, this
Right.
is just another shot that you are going to get to keep you healthy, you know, to prevent a disease. And it can be left, you know, at that with a 9-year-old or a, you know, 10-year-old.
And then address it later, a few
Sure,
years later.
absolutely.
Mm-hmm.
But the benefits that we're seeing with decrease in abnormal pap smears and hopefully a decrease in cervical cancer, you know.
Absolutely.
Wouldn't that be wonderful to wipe
good
that
not
out?
to- too
Absolutely.
good not to take
Absolutely.
advantage of.
Absolutely.
I'm going to jump to another subject here. We've heard a lot about video gaming, TV use, computer use before bed, sleep disruptions in adolescents and teens, overstimulation, overscheduling, so many things blaming our lifestyles and maybe our society and maybe the external influences, even outside of the family, on our children for anxiety, depression, and you know the sleep disturbances, the schedule, the skewed schedules or lack of a schedule, lack of a consistent lifestyle schedule. What do you say to adolescents and teens that come into your office about their schedules, about the overstatement, about video gaming, about TV use? Do you mention that in trying to? Do you try to detoxify them in that way, or what do you do? What do you say? I know that's a broad
vague
subject. But,
Well,
do you address video gaming and TV use if there's a person that comes in that has an anxiety issue? I guess that's a better question.
Oh, there's so many issues to address. Well, you know, the American Academy of Pediatrics recommends no more than 2 hours a day of screen time. That's video games, TV, computer, screen time. And I think our American culture far exceeds that. Exceeds that. But absolutely, that's addressed at, child visits, you know, as far as health and nutrition and sleep, but it's, you know, what are you watching?
Are you seeing kids who are going and just can't shut down at night?
Yeah, it really does seem to me like young people are just so much more connected in ways than I think probably we experienced, to the texting and the instant messaging. And I'm not saying those things are bad. Being connected with others is a good thing and can be a positive thing. But sometimes it's really overdone. You know, go, and then drop is not a healthy way to live. All things in some degree of moderation. So we can use things like guidelines of 2 hours of screen time to be jumping off points to discuss what's helpful about that. Well, if you're only watching TV or playing video games for 2 hours a day, you have more time to talk to your parents, to talk to your friends face to face, to read books, to get physical activities, to just engage in a balanced, healthy lifestyle. And so it can be an issue. Some people get so embroiled in these things that it becomes their new reality. And I don't think it's meant to be that way.
Right. And overscheduling is almost another demon that falls into that category.
Yeah.
Is
I mean, look
true?
at,
like you said, go, drop. That does seem to be the norm these days.
Yeah. Look at all the activities our kids are involved in. You know, having hockey players having ice time at, 6 o'clock, 5 o'clock in the morning, and then going to school, and then, doing band practice or, piano lessons or so many other activities that kids are involved in.
And all those things can be fine. There's nothing inherently bad about 6 a.m. ice time, but it has to be counterbalanced somewhere else. You can't have 11:30 or 12 o'clock at night homework time then.
Right.
It's just finding ways to stay in some degree of balance.
And in a way, the whole family has to reshape their schedules to fit the child so they are getting enough sleep and eating at regular times and things like that, right? And we're talking about nutrition and family, what families can do to improve the lifestyle. Nutrition and exercise are two of those things that we keep hearing over and over about how families need to improve their nutrition, increase their activity. You were talking about physical inactivity, and how that is linked to childhood and adolescent obesity, which we're hearing is an epidemic now. Epidemic, that's a strong word. What can we do about that? What can we do to increase our child's, maybe if they're not involved in sports or once were, maybe aren't as they get older, what can we do to encourage physical activity and to improve our nutrition? I think it's a family effort, is it not?
Absolutely. Oh, it's got to start in the family. It's got to start. What you buy, what you eat is what you buy at the grocery store is what you're going to eat. What you have at home is what you're going to eat. It starts, and it can't be feeding, Billy beans and then you sit and eat your potato chips or your pizza for a meal. It's definitely got to be a family effort. Absolutely, no question.
And you use the word epidemic, and that sort of makes us want to jump into some significant action. But all the fad diets and all the variety of things you find on the television says just do this for a week and you're going to lose all this weight. They just don't work for most people. And I think what's being found is slow but steady, measurable steps in the direction of health is what's more important. And recently, a group of nurses and a few of the providers at our clinic have started a program and are studying it. And the name is Small Steps, and it's looking for children that are in that at-risk or overweight category and helping identify what are some small measurable steps that you can take. Simple example, as I met with some patients of mine, is if you're not doing any kind of physical activity, you're not going to go from that to exercising 6 or 7 days a week. So let's agree upon taking the dog for a 20-minute walk once or twice a week. And then let's touch base again in a few weeks. And if we can accomplish that, then what's the next little step? Things like with younger children, agreeing that they're not going to use a grown-up sized plate to eat off of. They're going to eat off a kid-sized plate. They'll eat less if they eat off of a kid-sized plate than a grown-up sized plate. Little things like that, but then just what can we agree upon rather than us as the healthcare provider saying you need to do this. It's much more effective if you say what can you do? What do you think you can do? And let's come to some agreement about that.
Yeah. We're going to take a break, and we'll be right back to talk about small lifestyle changes you can make to make your family healthier. Thank you for joining us. We'll be right back. Hi, we're back, and we're discussing anxiety, depression, and lifestyle changes that you can make to make your family healthier, happier, and maybe even thinner. Let's go back to talking about what a subject we touched on earlier. I asked you about anxiety as it related to TV use and gaming and those sorts of things, but along with anxiety goes depression. Are we seeing more adolescent depression these days than we used to?
I think we're seeing it more, and it might be just because we're looking for it more. And I think that's a key thing. Year after year, the top 3 killers of adolescents are number 1, car accidents, and then number 2 and 3 depend on where you live, but it's homicides and suicides. And they kind of where you live depends on which is number 2 and which is number 3. But depression and suicide are very, very much linked. And I know Nancy sees a lot of adolescents in her practice.
Yeah. I think we're getting better at screening for it and recognizing it. And I think the stigma is getting less and less, that depression isn't, it isn't a personality weakness. It isn't something. It's a chemical imbalance, and it's a real illness. And you do get better. You do get better. And I think we have better treatments now. It's not just medicines. There's many things that we can do, and there's many lifestyle changes that we can do. We know exercise improves our self-esteem and our endorphins and makes us feel better. So just getting out and getting some exercise. But is it more prevalent? But I think we're recognizing it better, and we're able to treat it, and it's not a kind of a close the door kind of thing anymore.
People are more open about it.
More open about it. Absolutely.
What other lifestyle changes can you recommend, or what other alternatives to medication do you use for the treatment of depression?
Well,
with children,
a big part of it is just how you structure your life, the routines. As Nancy mentioned, there is quite often a chemical issue, a true medical chemical issue, but the environment in which you live can factor in as well. Situational things, maybe there's problems at school or problems at home, and then that sort of adds fuel to the fire. But having regular sleep cycles, going to bed at similar times, getting up at similar times, having regular physical activity, even if you're not feeling very hungry, eating meals at predictable kind of times. So in this case, routine actually can be helpful, because a lot of people who find themselves in a state of depression are really, they just get completely out of their routines.
That's interesting. I didn't realize routine played such a big role in the mood changes. And
right, routine, and there is a familial component. So certainly depression or anxiety can certainly run in families. We do see that. So it's kind of recognizing that. And when you come in for physicals, we many times do take a family history and find out what is in your family, so we can be aware of that. And certainly that's got to be on our radar too. And if you start having those feelings of, I feel sad, and I don't find joy in life anymore, I don't have interest in things that I normally like to do. Either I want to eat all the time, or I don't feel like eating. I want to sleep all the time, or I can't fall asleep. I lay in bed and ruminate on thoughts. Those are all some symptoms of depression. Certainly there's triggers in life that can set it off: a death, a divorce, a job change, a move, and it could be something that you chose to do or something that got thrust upon you that will kind of sometimes set us off. And it's recognizing it, and coming in and saying something to your healthcare provider. There's so many things we can do, and you will get better. You can get better.
That's optimistic, and that's helpful. And I certainly attention deficit and hyperactivity disorders and all those things are also. And can those be improved by routine?
Well, yes. How
changing your routine or structuring your routine better?
A child or an adolescent or even an adult who is diagnosed with attention deficit disorder, with or without hyperactivity, there's two main components to treatment, and medicines are only one of them. And not everyone needs medicines, but everybody needs behavioral management. So if, for instance, your child has difficulty with attention, staying focused in class, if you sit them in the back of the classroom where they can see all of their friends and all that they're doing, they're much more likely to be distracted, as opposed to if you set them in the front of the room. Or if it's time to do homework at home, you set one assignment in front of them. So these are kind of just some simple examples of how you can set up an environment where they're more conducive to have successes. Yeah. Because no one chooses to have attention deficit disorder, but we still have to deal with it.
So the environment is a key factor.
Yep.
Changing the environment.
Yeah, there's many things schools are doing too, keeping kids focused. Sometimes kids just have that energy, and it's not something they can control. They don't choose to have that energy or to act that way. It's them. It's how they're wired, and it's how we can best help them. And medicine's definitely, it's a tool. It's one tool in the armamentarium, but there are other things, definitely.
That's wonderful.
Yeah.
Well, that concludes our segment for tonight. Thank you for joining us tonight for Health Connections. You can go to www.ksmq.org for more information about the topics we discussed tonight. Be sure to join us next week on Health Connections. Thank you, and have a great night.